So now the transmission of this. So, and again, kind of thinking back to the infectious disease kind of principles that you kind of know of. And again, obviously you have to have the agent, and there has to be kind of a reservoir, a kind of a natural place where this virus lives. What they believe that to be is kind of in the fruit bat. And again, basically a reservoir is something that it's kind of a natural carrier. It doesn't actually cause the disease, but basically it's someone that actually has the virus in them to where they can then go. So the next part's kind of looking at the portals of entry, portals of exit, and kind of the modes of transmission. So again, kind of the story here is kind of the fruit bats basically who have the virus eat fruit, and then those pieces of fruit are dropped on the ground, and the saliva that's now in the fruit, and or basically because of the chimpanzees, gorillas, antelopes, other animals basically eat the fruit bats as well. So basically now that virus is now transmitted to these animals, and then these animals basically expose humans in the form of kind of bushmeat. So chimpanzees, gorillas, obviously antelopes, porcupines, these are kind of sources of food in Africa. And so if not treated properly, or basically kind of not heated properly, as they eat the bushmeat, now that virus is now transmitted to humans. Then obviously you've kind of heard how it's transmitted from human to human. It's kind of basically dealing with blood or other bodily fluids, direct contact with recently contaminated items such as medical equipment. It has not been documented the spread through the air. They keep kind of checking, but it is not, that's, some folks are kind of the conspiracy theorists are putting out there that basically it's mutated, but as far as their studies have shown, there's nothing that causes it to be airborne. Basically, these are entry points through the mucous membranes. So the virus does, and basically it can live in a dried state for a few hours, but it can survive for several days, if not a little bit longer, maybe up to some weeks in fluid. So, again, once the animal dies or the human dies, that they're still contagious. So any fluid that is within the animal or the human is contagious and should be considered a source of transmission. So we kind of need to make sure that we take proper protection against those. So, and we can kind of talk about, right? So you're, simply just because you get you get splashed doesn't mean you're necessarily exposed. So this is kind of with everything else. And we actually need to kind of put a comma in there, right? So it enters through your mucous membrane, so your nose, mouth, eyes, any other skin opening, which is kind of basically why they, the protective equipment is so important, because basically it's covering your face, it's covering, you have the mask to kind of protect the virus from entering through your nose, through your mouth. You have the goggles for your eyes. You have multiple pairs of gloves. You have the impermeable membrane, so that doesn't allow liquids through there. So it kind of protects you. Once it does enter the cell, or actually, I guess once it enters your body, it does move to the cells. Initially kind of infects the monocytes and macrophages. Again, these are part of your immune response system, so it does kind of affect those cells. And then secondarily, after it infects those, moves to your hepatocytes, your liver cells, your endothelial cells, and your epithelial cells. So again, it's a RNA virus, which basically means that it uses our body's RNA process to transcribe and then basically reproduce new viruses. It basically takes over our protein synthesis processes and interferes in our way and interferes in our body's way of producing its normal functions. And basically now we have these viruses are now spread throughout our body. And we kind of talked, right? So it basically affects your hepatic cells and your endothelial cells. Again, remember, your endothelial cells are basically kind of the internal lining of your blood vessels. So basically, if there's endothelial damage, that obviously is going to lead to increased vascular permeability, which kind of basically then leads to clotting and fluid loss. Once you start affecting the hepatic cells, now it starts to interfere with the blood's ability to coagulate. Basically, can lead to DIC, which ultimately can then, now not only are your capillaries kind of more permeable, or you're losing fluid, but you're also limiting the body's ability to clot, which is kind of where the bleeding comes from. Ultimately, all this kind of leads to shock, right? It leads to kind of multiple organ failure and shock. Ultimately, these folks typically die of hypovolemia. So we need to kind of think in terms of that as we're treating the patients. first, kind of before we get into the signs and symptoms of stuff, we kind of need to talk about incubation period, right? So the incubation period is the time from when you're exposed to the time when you start showing signs and symptoms. The typical period is kind of 8 to 10 days, but you do kind of notice it goes out here to 21 days, which is what you've kind of been hearing in the news. So that's the kind of the magic 21 days. So it can take you 21 days before you start developing some of these signs and symptoms. Probably what you've kind of heard is the early onset signs symptoms. It kind of starts out kind of like influenza. So you kind of have just kind of this general malaise, pain in the joints, pain in the muscles, headaches, sore throat, even kind of a fever early on. So the 38.3 is in Celsius. The Fahrenheit equivalent of that is 100.9. So again, just kind of start feeling bad. 5 to 7 days later, you start developing kind of secondary symptoms where you'll start to getting shortness of breath, the cough. You'll start getting the vomiting, diarrhea, abdominal pain. Ultimately, kind of the later stages, you start to kind of developing the rash. So that's kind of a purpura or ecchymosis that develops. Ultimately, we kind of talked about, how ultimately they, your endothelial cells start to kind of leak. We start to kind of develop thrombocytopenia because of the inability to clots. Ultimately, again, that leads to kind of the multiple organ dysfunction, and then ultimately kind of death. Typical kind of period that they're kind of looking at is, death, if it does occur, is anywhere from 6 to 16 days typically. And like we said, it's kind of the result of hypovolemia. On the flip side of that, recovery can also begin anywhere from 7 to 14 days after onset. So, kind of treatment kind of plays a role. This is kind of like any other viral infection. Once you kind of get it, your body has an immune system that can help kind of deal with it. Ultimately, you kind of get over the hump, and then you're able to kind of move on.